what are the health disparities in the African diaspora, or just in the U.S. and other parts of the world? What do you consider to be the health disparities?
For the most part, I would say again, education is really, really one of those key things. In the United States, there's so much information. People are educated. So again, they are well versed with, okay, what they should do, and maybe the resources are there also. But then in many other countries, I'll use my country, Cameroon, for example, the percentage of people that are educated or that are aware, like health awareness, paying attention to their health, just because of the knowledge, is much, much less compared to a country like the United States. So that's one. So education plays a role. But then I would say also just that culture thing, even in the United States, with all the resources, with all the information, they tell, on TV, you hear, today social media, we see so much, but then, and then we have all the great hospitals, but they are still, I would say, especially men, they still don't go see the doctor unless the pain is so severe, and sometimes it's like the heart attack that before they make it to the hospital, they're going to die. So the health disparity, I would say people of color, especially the men, but even women, but especially the men, they don't see the need to go, why go see a doctor when you don't see any rash, or you don't feel any pain, or nothing is happening. So, but there's a whole lot that could be happening that we don't know. And that's why it is so important, especially in the United States, where we are privileged that we have a lot of resources to take advantage of them. And when I talked about education, when those who are like either in the villages, they don't know better. So when you know better, you do better. So they are not educated. When we go to school, no matter what profession, we pursue, but then we learn a lot about our health also, just being in school. So that education, it just helps, people who are educated more to say, okay, they want to pay attention to their health. But I would say also religious, some religious beliefs, like for me being a Christian, and what the Bible says. The Bible tells us that our body is the temple of God. So I need to honor God with the temple, which is my body. In what way? I have to be careful about what I watch. I have to be careful about what I say. I have to be careful about what goes through my ears. I have to be careful about what I eat, right? So the Christian could say, oh, I'm not fornicating, I'm not committing adultery, but you are eating too much. Gluttony is a sin per my religion, right? So if you're a Christian and you're eating too much, you're abusing this body. So I would say, if it's not good, you're not honoring God. So paying attention to what you eat, the quantity that you eat, or like taking care of the body, is because I'm a Christian and I want to glorify God. So maybe somebody else who's not a Christian doesn't see their body as a temple. That difference is right there, right? So the other thing is the resources. Some people in a country like the United, they have health insurance. So if they have health insurance, they can see any doctor, maybe the insurance. So depending on what the insurance can cover, that could help them to be able to have access to different types of treatments. But then in an area where you don't have insurance, you have to pay everything from your pocket, then you're not even able to see some particular type of doctor or have access to some types of treatments. And I can tell you also, by doing a lot of health fairs in Africa and growing up in Cameroon, because of the lack of resources, many people felt that, okay, the hospital is a place that you go to die. You know why? Because when people are very, very sick, that's when they take them to the nearest hospital. And when they get to those hospitals, there are few medical doctors that, let's say, you're going to use Maryland, for example. Maybe there's one doctor in all of Silver Spring. There's one doctor in all of Delaware. So it's hard for you to see a doctor, and then the patients die because they waited too late to get to the doctor, and by the time they get there, so the mindset is like, oh, okay, why bother to go to the hospital? Because when you go to the hospital, you're going to die. Language barrier is another disparity. So like here, the language barrier, if you're not able to communicate with the patient effectively, how are they going to be able to take what you are telling them and applying it to help them. So that's why it's important, knowing the culture of the patient and being able to interact with them or through an interpreter so that that patient can be able to hear and understand what you're telling them in order for them to apply and for it to work for them. So knowing all of these disparities is so important because everybody is so valuable. Everybody is so important. So if we're in a country like the United States, we are really cognizant and we pay attention, we do our best today. Even as we educate our students at Howard University, we tell them to say every patient, no matter what their background is, when we see that patient, we have to give that patient the same quality of treatment, of care that everyone else. So whether their economic status, their language, or their culture, they deserve the best. So that is so important.
I am so glad you mentioned that as well about treating all the patients equal, because that's also one of the definitely the health disparities. Our people sometimes they don't feel like they're valued when they go to the hospitals. They don't get treated better than, for example, the Caucasians, and that can discourage them from going to the hospital to seek help.
Mm-hmm.
Or sometimes you in labor but you give birth and you're telling your doctor you have an issue going on, and they're like, no, that's your people because you are African. Your pelvic is different, and then you die in labor because you're not listening to, they don't understand you and your culture or the people. So even not understanding from the healthcare system to treat people of color the same as the Caucasians, and also understanding the different people